It is the inaugural Lagos Trauma Conference organized by the Lagos State Ministry of Health. The conference is aimed at advancing trauma and emergency healthcare systems for a thriving Lagos.
As our city continues to grow and thrive, so do the demands of our healthcare system. Trauma care and emergency healthcare services are central to this, as they are often the first line of defense in saving lives and reducing preventable deaths.
Wife of Lagos State Governor Dr. Ibijoke Sanwo-Olu harped on the need for policies that will serve as bedrock to providing emergency and trauma care.
To call emergency preparedness, and we did that almost every month. And when we were doing it, even as a medical director, we ensured that even the gate man must know what happens. If there's anything going wrong in the stadium, the gate man, that's not the time that you start flexing muscle and locking the gates. You don't lock the gate then. Immediately, you have gone through the training, you've gone through the drill, you've done your basic life support. Everybody knows their role. From the gatesman to the records officer, to the nurse, to the doctor, everybody knows what to do. And so those drills are very important at all times.
While highlighting various needs that will help provide effective services of emergency trauma care, Permanent Secretary of Health Dr. Olusegun Ogboye appealed to local government heads to provide space to create emergency points across the state.
The goal of pre-hospital care, as you can see here, is to stabilize the patient and swiftly get the patient to the nearest possible hospital. An ambulance may go to 4, 5 hospitals before finding a hospital that will actually allow them to hand a patient over, because everybody says we don't have space. If we were to be able to know clearly from the dispatcher or from the ambulance where exactly bed space is, it cuts down handover time, and of course when a patient can begin to get access to proper hospital care.
Have an integrated and standardized referral system for, even if it is going to be funded by health insurance, to work. There must be increased funding and unitary pool for emergency services. As I said, Lashma has started with the creation of its emergency fund, but that fund must be swelled to be able to cater for all the residents, as we are hoping to do with the executive order.
Also at this conference, officers of the Lagos State Ambulance Services, LASAMBOS, appealed to Governor Babajide Sanwo-Olu to make the department an agency, and the governor assented.
A bustling megacity of our start. You know, it comes with a lot of complexity. It comes with a lot of demand. It comes with a lot of resilience. But in all of it, we cannot forget or take to chance our healthcare system, particularly in the area of emergency care.
Aminat Elegushi, LTV News.